Hello, and welcome to part one of Anatomy of the Sinuses. The sinuses, as you know, are large air-filled cavities which are actually lined with mucous membranes. And the sinuses are divided into four groups according to the bones that they are housed within. So we have two maxillary sinuses, and they are found then, of course, in the maxilla or the maxillary bones of the face. We usually have two frontal sinuses, and they are found in the frontal bone. Remember, the frontal is a cranial bone, of course. We have many ethmoid sinuses found within the ethmoid bone. You can see that in green here and here, and of course the ethmoid bone is a cranial bone. And then we have one or two sphenoid sinuses found in the sphenoid bone, and that is indicated on your diagram here in blue and back here. Notice the maxillary sinuses are part of the facial bone structure. The other sinuses are found within cranial bones. Interestingly, the paranasal sinuses begin to develop in the fetus, but only the maxillary sinus exhibit a definite cavity at birth. The frontal and sphenoid sinuses begin to be visible on radiographs around age 6 or 7, and the ethmoid sinuses develop last. All the paranasal sinuses are fully developed by the late teenage years. In this lecture, we will discuss each sinus group in more detail. And let's begin our discussion with the maxillary sinuses. So the maxillary sinuses are paired sinuses, one found within each maxilla. So there are two, there's a pair of them. An older term for the maxillary sinus is the antrum, which is an abbreviation for antrum of Highmore. From the front, remember, the maxillary sinuses look like candy corn or a piece of pizza. You can see they're kind of triangular in shape. From the lateral perspective, the maxillary sinuses appear more cube-shaped. Usually, maxillary sinuses are about 3 to 4 centimeters tall and 2.5 to 3 centimeters wide and deep. The bony walls of the maxillary sinus are thin. The floor of each maxillary sinus is slightly below the level of each nasal fossa. And you can kind of see that here. Here's the bottom of the nasal cavity, and then the maxillary sinuses extend a bit below that. The two maxillary sinuses vary in size from one person to another, and sometimes even from one side to another. Projecting upwards from the floor of each maxillary sinus are several cone-like elevations related to the roots of the first and second upper molar teeth. And you can kind of see that here on our diagram. Occasionally, one or more of these roots can allow infection that has originated in the teeth, particularly in the molars or the premolars, to travel up into the maxillary sinus. And of course, you can easily visualize fluid in the maxillary sinuses on our Waters projection, and sometimes even air fluid levels if the patient has been upright long enough. So you may have noticed on the first slide that it said there is a communication system between the sinuses and the nasal cavities. And that's true. All paranasal sinus cavities communicate with one another and with the nasal cavity, which is divided into two equal chambers or fossas. The line of communication from the maxillary sinus to the nasal cavity occurs at the opening into the middle nasal meatus passageway, which is located at the superior and medial aspect of the sinus cavity. So in other words, and this isn't, I'm not going to test you on this, this is just for your information, but you can see that there's an opening here, and from the maxillary sinus, you have communication into the nasal cavity through the middle nasal meatus. Again, not super important that you write that down. Remember, when a person is upright, as we've talked about, any fluid that's trapped within the sinus tends to remain there and layer out. You get that air fluid level. We should always perform sinus imaging upright for that reason and no tube angle. Okay, next, let's discuss the frontal sinuses. The frontal sinuses are located behind the level of the glabella, and on our diagrams here, of course, they're depicted in orange. The frontal sinuses rarely become aerated or air-filled before the age of 6. The maxillary sinuses are always paired and are usually fairly symmetrical in size and shape, but the frontal sinuses are rarely symmetrical. The frontal sinuses usually are separated by a septum, which deviates from one side to the other, or may be absent entirely, resulting in one single cavity. However, 2 cavities generally exist in most of us, and they'll vary in size and shape. Frontal sinuses are generally larger in men than in women. They may be singular on the right or the left, or they may be paired as shown here. Interestingly, they may be absent altogether. So there is a wide variety in the number, size, and shape of frontal sinuses from person to person. Next, let's talk about the ethmoid sinuses. The ethmoid sinuses are contained within the lateral masses or labyrinths of the ethmoid bone. And of course, on our diagram here, they're depicted in green. These air cells are grouped into anterior, middle, and posterior collections, but they all intercommunicate. And when viewed from the side, the anterior ethmoid sinuses appear to fill the orbits. You can kind of see here's the orbit, and it looks like the ethmoid sinuses are in the orbital region. And this occurs because portions of the ethmoid sinus are contained in the lateral masses of the ethmoid bone, which help to form the medial wall of each orbit. Next, let's talk about the sphenoid sinuses. The sphenoid sinus lies in the body of the sphenoid bone, directly below the sella turcica. So if you can kind of picture, here's the sphenoid bone, and then the sella turcica is going to be right here. And there in blue is the sphenoid sinus. The body of the sphenoid that contains these sinuses is cubic and frequently divided by a thin septum to form 2 cavities. However, this septum may be incomplete or even absent entirely, resulting in only one sphenoid cavity. Because the sphenoid sinuses are so close to the base or the floor of the cranium, sometimes pathologic processes make their presence known by their effect on these sinuses. For example, after skull trauma, patients can develop an air fluid line in the sphenoid sinuses. And this air fluid line may be evidence that the patient has a basal skull fracture and that either blood or cerebrospinal fluid is leaking through the fracture into the sphenoid sinuses. This condition is known as a sphenoid effusion. Effusion, again, just meaning fluid. A basilar skull fracture, or a basal skull fracture, is a fracture of the base of the skull, typically involving the temporal bone, the occipital bone, the sphenoid, and or the ethmoid bone. This type of fracture is rare, occurring as the only fracture in just 4% of severe head injury patients. Such fractures can cause tears in the membranes surrounding the brain or the meninges, with resultant leakage of the cerebrospinal fluid. And that leaking fluid may accumulate in the middle ear space and dribble out through a perforated eardrum. Or it may drip into the nasopharynx via the eustachian tube, causing a salty taste. And I have actually seen this type of trauma at clinicals. I've seen blood coming out of the ears. And again, that's a sign of a skull fracture. Let's discuss the osteomeatal complex. The pathways of communication between the frontal, maxillary, and ethmoid sinuses provide drainage between these sinus cavities. These drainage pathways make up the osteomeatal complex, which can become obstructed, leading to infection of the sinuses, or sinusitis. CT is the best modality to evaluate the osteomeatal complex. Now, you don't need to write this part down. This is just for your information. But there are two key passageways, including the infundibulum and the middle nasal meatus. So here is the infundibulum, and here is the middle nasal meatus. And of course, you have one on each side. The large maxillary sinus drains through the infundibulum passageway down through the middle nasal meatus and into the inferior nasal meatus. The uncinate process of the ethmoid bone, which you can see here and here, makes up the medial wall of the infundibulum passageway. The ethmoid bulla, which you can see here and here, receives drainage from the frontal and ethmoid sinus cells, which drains down through the middle nasal meatus into the inferior nasal meatus, where it exits the body through the external nasal orifice. And here is what I'm talking about. This is a CT scan of the osteomeatal complex. And of course, this is a coronal slice, and we image this in 1 millimeter slices. So you can imagine it's much easier to visualize these minute structures in CT than it would be in a plain X-ray. On an actual radiograph, sinuses sometimes aren't clearly defined because the various sinuses overlap and kind of superimpose each other. If you think about the Caldwell here, the ethmoid sinuses are superimposing the sphenoid sinuses, which lie posterior. So can you see the 4 sinus groups on these X-rays? Well, let's define them here. You have your frontal sinuses here and here, and of course you can see the crista galli, which is part of the ethmoid bone. You have your ethmoid sinuses behind the nose, and you can see them here, and your sphenoid sinuses, which are behind your ethmoid, but in front of the sella turcica. And then, of course, your maxillary sinuses are here in the cheeks. So here is a Waters view or projection with the mouth open. And opening the mouth in this projection actually removes the upper teeth from direct superimposition of the sphenoid sinuses. So in this case, the frontal are here, ethmoid behind the nose, maxillary in the cheeks, and then your sphenoid would be back here behind the ethmoid. Remember, in this projection, the chin is on the board, so MML is perpendicular to the image receptor. And then lastly, here's our SMV. And remember, the ethmoid air cells extend to each side of the nasal septum. So you can see ethmoid here. Sphenoid are behind ethmoid or posterior. The maxillary are in the cheeks. And then we do not see the frontal sinuses in this projection. Remember, A is your mastoid air cells, which are part of your temporal bone, and then B are your petrous pyramids. Remember, the condyles of the mandible should be anterior to your petrous ridges. All right, this concludes our sinus lecture. If you have any questions, let me know. Thank you.